Okay, here's our pelvis. Pelvic floor muscles sit on the bottom of the pelvis, okay? We're gonna talk today about how the position of these pelvic bones affects the ability for the pelvic floor to contract and relax to the best of its capacity, okay? Obviously, that also depends on what the diaphragm's doing, but we're gonna focus on the pelvis today. So what we can look at is if we demonstrate a pelvic floor here, when we take those iliums here and we internally rotate them, okay, so we pull them closer together at the top, you can see that that is going to lift the pelvic floor. It is going to create a shortening or a contraction of that pelvic floor. That is where we see a wider infrasternal angle, okay? Opposite, if we create more of a narrow infrasternal angle where the iliums externally rotate, we see that the pelvic floor actually dips down and descends and lengthens, okay? So we can create contraction and relaxation with the movement of these bones, okay? We also can affect the ability of the pelvic floor to contract and relax with the position of the sacrum, okay? So if our sacrum, if our sacrum goes into nutation, which means that it tips forward, okay? I'm struggling here. It tips forward. That is going to create more of a lifting effect on the pelvic floor. So it is going to lift and contract versus when the sacrum counter-nutates, you can see how that's going to let that pelvic floor kind of relax and descend a little bit, okay? Also, our entire pelvis can anteriorly tilt and posteriorly tilt. And what that does is the effect of gravity on the pelvic floor changes, okay? So if you have like a bird's eye view here, if you anteriorly tilt, you'll see that that sacrum actually starts to cover the pelvic floor a little bit, protecting it from forces, downward forces from gravity, right? Whereas the anterior pelvic floor is left a little bit more open and vulnerable, okay? We tilt backwards into a posteriorly tilted pelvis, the opposite happens. The anterior pelvic floor is a little more protected, posterior has a little bit more pressure down from gravity, okay? So you can just see how the position of this pelvis will affect the length and tension of the pelvic floor and its ability to contract, okay?